My name is Austin Hayes. Thank you for scheduling your consultation appointment. This video is meant to give you some information about labiaplasty. Write your questions down, bring them with you to the office. We'll get all of the specific questions answered. So labiaplasty operation is an operation I perform frequently. It's a great operation. What's really nice about it is people come to me with really a lot of symptomatic issues from having enlarged labia. So these are things like pulling, tugging, chafing, working out, or having pressure on the area and getting a significant amount of swelling that's uncomfortable. And really a labiaplasty operation is neat because it takes a part of your body that you think about many times a day and really minimizes that. It should get rid of the symptoms pretty much completely the great majority of the time. As people learn about labiaplasty, many people don't even know it's a procedure that was an option for them. So as they learn more about it, they start to realize that there's two main techniques. Essentially, there's an edge technique and what's called a wedge technique. An edge technique uses an incision along the labia. We want to leave about 1 centimeter, create a nice natural shape, and then all of the extra tissue on the labial edge beyond that is removed. One of the benefits is that people come in and they may have a darkened or ruffled labial edge, which is completely normal, but it might bother them. And so an edge does a great job of removing that. It's the procedure I perform most often. A wedge technique removes a triangular shaped piece of tissue. One of the limitations of it is that if there were to be a wound healing problem, it can leave notching. For me, it does less of a good job of shaping the labia, and also it doesn't remove the edge if that is somebody's goal. So one of the things people learn as they go is that if they have enlarged labia minora, many times they have extra clitoral hood tissue. So if I do a labiaplasty operation, 99% of the time I'm doing a clitoral hood reduction at the same time. That helps me get rid of the extra tissue of the clitoral hood, which tends to be attached to the labia minora. Helps me keep the clitoral hood and the labia minora in balance, keeping you looking natural. One of the first question I get when I mention clitoral hood is, will I lose sensation? And it's important to know that when I remove that skin, I'm only going through the skin. I'm not working around the deeper nerves. So risk of losing sensation of the clitoris is highly unlikely. The recovery after the operation is performed under IV anesthesia. You go all the way to sleep in a fully accredited surgery center that's on site at my office. The recovery tends to be pretty good. Some people don't take pain medicine. Most do though, and they'll take pain medicine for anywhere from usually 2 to 3 days. The recovery kind of goes in phases. Phase 1, home and icing, really laying low. Usually that's about 3 to 5 days. We really want to get on top of swelling and minimize that as much as possible. After week 1, people are starting to return to work, particularly if they have a desk job. Even slightly more physical jobs, people are going back at 1 week. Week 2, you're really turning the corner, less swelling, feeling more mobile, starting to feel back to normal. And really that's kind of at the end of week 2 is when people feel back to normal. In those last 4 weeks, however, there are activities you can't participate in. So sexual activity, you don't return to sexual activity until week 6. And then really vigorous cardio, riding a bicycle with lots of pressure in the area. Those are 6-week activities. So labiaplasty, great operation, really helps people a lot with their symptoms. I look forward to seeing you in the office, and thanks again.